So now I'm going to demo enteral feeding or enteral medications via the nasogastric tube. So orders for these, there are several that you're going to pick from. You could have feeding, which may be the Jevity. So this order says start half strength Jevity at 50 mils an hour via NG tube. So half strength Jevity, this is the one I'm going to demo because it's going to be on the pump. You know it's on the pump because it tells you a mils per hour. Mils per hour is a continuous feeding of the pump. Okay, I'll demo Jevity. The other order is Ensure 180 mils QID via NG tube. So that's a bolus. So that means that I get 180 milliliters of Ensure, pour it in a cup, and I'm going to stand here with the syringe and pour it in. It's a bolus feed, and we would do that 4 times a day according to this order. So it's a bolus feed. It's not on the pump, and I know that because it's a total volume 4 times a day, not mils per hour, right? And then a med. One of the orders you could get would be a med. So give potassium chloride. Potassium chloride, oral liquid, 20 milliequivalents BID. So you could be doing a bolus of that. So I'm going to demo the potassium chloride and the Jevity just to show you the difference between a bolus and a continuous feed. But just know that you would only be getting one. You're not going to get both of these orders. So I'm verifying, just like with meds, my order to my MAR. And it's going to be front and back for some of these. Then I also have lab values for my patient. So verifying all of that. Any information I need, I'm giving potassium chloride. So obviously I want to look at electrolytes, my potassium level. And then for Jevity, just hydration, nutritional status, all of those things. So I'm going to go get my stuff. So at my cart, I'm going to pull, and I'm going to do my 2 checks. So my 2 checks with my potassium. Here we go. Got my bottle. Check 1. Got my first check with my Jevity. Now I'm going to do my second check with my potassium and my MAR. Second check with my Jevity and my MAR. I'm going to grab my supplies for this. So for my Jevity, it's continuous on the pump, so I need a feeding bag with tubing. I need a couple medication cups for my flushes. And then for the actual med, I need medication cups. I also need my irrigation set. I'm going to set that stuff down. I've done my 2 checks with my Jevity and my potassium chloride and my MAR. So these are more supplies than you would need. And if you're doing a bolus, like I said, of a formula, 180 mils of the Ensure, I would have checked, this is Jevity, but I would have checked Ensure and I would be pouring into this cup, but I don't need this cup for what I'm demoing. So, same procedure, washing my hands. Hello, Mr. Hurt. I'm back. How's that tube? It's okay. Are you having any irritation? No. Okay, it's been to suction, but we've taken that off suction because I'm about to give you start some feeding, and then also be giving you some meds. And then as we're giving you the feeding and meds, you need to make sure your head is always elevated at 30 degrees or higher. You probably don't know that, but it's got a little gauge on the side of the bed here. If you feel like you're too low, you can ask anyone to look and make sure you are elevated. Any distension, cramping? No. Could listen to vowel sounds if I wanted to. Probably should. But I'm going to go ahead and do my 3rd check. First thing I'm going to give is my potassium because once my bag's hanging, I won't want to stop it to do the potassium. So my bolus, I also got water and my irrigation set while I was washing my hands. For the potassium, 3rd check. So I've got potassium chloride, 20 milliequivalents, oral liquid via NG tube BID at 9 and 2100. It's 9 a.m. Pretend what I have on hand, Potassium chloride, 20 milliequivalents per 15 mils, so I need 15 mils. Sprayer's 3, 20, 20. I'm going to pour this up. So go down to 20. So I need 15 mils, 20 milliequivalents, right? 15 mils. Can verify that with my instructor if I need to. She may not want to. And then I'm going to do my 2 flushes. So I got a 30 ml flush before my med, 30 ml flush after my med. Alright, I've done my 3 checks. Let's go to our patient. Tell me name and date of birth. I'm a HERT 1234, and their RN number looks the same as my MAR, 88109-530. Okay, any allergies? No. Alright, great. So I've completed 5 rights. Patient, drug, dose, time, route. Patient. Yeah, you know. Oh, that's all fine. And then the 6 right documentation after I'm done. So first thing I need is my syringe, test placement, because this has been clamped and it may have shifted. So same as insertion. Clamp the NG tube, put my syringe on. Shush. Okay, pull back any GI contents. If you've got any residual, if it's over 100 cc's, then you're not going to administer anything. You'll need to call the doctor. If I have very little, I can do a pH strip. Looks good. Put my gastric contents back. Clamp my tube again. There we go. So take out my plunger. Tube. So first thing I'm going to do is flush with my 30 mils. Oops, sorry Mr. Hurt. Not really going to do it because again these stomachs are small. Administer my med. And then I'm going to flush after my medication. Hold it up, watch it all go down. Alright, there's your medication. The potassium chloride. So that would be your checkoff. And if you had the Ensure, the Bolus feed, this cup would have been much larger with the Ensure, but exact same procedure. So now, I'm going to move this over and do my Jevity. So I've washed my hands, I've done all that, identified my patient. I'm going to do my 3rd check with my Jevity as I'm pouring it. Now this order is a little different, okay? So when you see it, it's half strength Jevity at 50 mils an hour. On your checklist it says I need to make a bag for 4 hours. So 4 times 50 is 200. It's half strength. So that changes things. Half strength Jevity means 100 milliliters of Jevity. (100 milliliters of water). So that is my half strength Jevity, 200 milliliters, because my order says 50 milliliters per hour. Hope that makes sense. So that's my 3rd check with that. I've identified my patient. That's my 5 rights. I'm ready to roll. So clamp your tubing, roller clamp, right? Pour in my 4 hours of Jevity, half strength. 200 milliliter total for 50 mils an hour. time this, it's a little different. Hold your drip chamber upside down. Undo your roller clamp. I don't know if you can see it. So it gets a little ways. Flip it over. And then you can see the drip chamber's half full. And I don't have any air in my line here. Okay? So I'm going to come all the way through to the end. Just like IV fluids, you just watch it. This one you don't want to waste though. Okay. We're putting it in. Close my roller clamp. So the drip chamber has a nice little pocket here that slides in. And then this part here is very stretchy part of your tubing. You stretch it around that wheel. And there's a black, I don't know, filter I guess, that sits right in this part, okay? So it stretches up and just sits right in there. Bring your tubing out the side. And that white part just holds it in, okay? When you get hands on, it'll make more sense. Undo your roller clamp because now it's locked in your wheel. Put this to the side. Go through the procedure of verifying placement again. So 20 mils of air. Swoosh, aspirate GI contents, test them, put them back in. Clamp. Before I give my med, I'm gonna flush. I'm just kind of running through this for sake of time. Flush 30 mils of water. All right, all that went in, we're good. Clamp. The syringe is done. So, undo my cap, put it on the end of my NG tube. And then let's do the pump. Now, hands on, just grab me today for figuring these out. It's fairly simple, but if you press too many buttons, you're gonna mess up the programming. So turn it on. Right. There we go. Let it go through its thing. So if it's got 4 digits up here, that's a total volume. If it only has a few digits, then that's going to be your mils per hour. So you can use the buttons here to turn it up, or there's a dial knob here. So my order said 50 mils an hour, correct? So turn it up to 50. And then volume to be delivered. See, 4 digits, and I've got 200 for my amount to be delivered because we're going to go over 4 hours. And then start. So it's going to flash. If you don't push buttons fast enough, it'll flash back and forth. So if you change this, you've changed your mils per hour. So volume to be delivered, and then it'll switch back over to my mils per hour. Press start. And then you can see my little dials turning, the drip chamber drops are coming down, and it's going. And that's it. You are finished with that check off.